2 years ago, Danny Davis was diagnosed with stage 4 melanoma that spread to his lung. He faced the threat of surgery to remove part of his lung.
The melanoma reoccurred in my lung. I was devastated. And you don't sleep. You don't sleep. You don't sleep for the first couple of weeks. You just don't. And you start doing the research that you can to find out how to live. And that's what ended up bringing me to the CyberKnife.
Danny is not alone. Each year, approximately 1.4 million new cancer cases are diagnosed. But a cancer diagnosis shouldn't be considered a death sentence. Today, Danny is living a normal life thanks to a revolutionary device called the CyberKnife system.
The CyberKnife is not restricted to any part of the body. It can treat any tumor, both cancerous and non-cancerous of the head, as well as outside of the brain, lung, abdomen, pelvis, extremities. There is no limitations for this machine.
The CyberKnife is the first and only robotic radiosurgery system designed to treat tumors anywhere in the body. Through the use of image guidance and computer-controlled robotics, the system delivers high-dose radiation beams from virtually any direction, while minimizing damage to surrounding healthy tissue or critical structures like the spinal cord. It continuously tracks patient movement, detects the tumor's new location, and corrects the treatment angles accordingly. The system enables physicians to aggressively treat tumors with sub-millimeter accuracy.
CyberKnife locks onto the tumor, moves with the tumor, and as a result we don't treat excessive normal tissue. It cuts down on the side effects that we normally see with conventional radiation treatments.
In the past, patients like Danny Davis may have been limited in their cancer treatment options. Not anymore. Now this proven robotic radiosurgery system is improving patients' quality of life, both during and after treatment.
When I climbed off that table after the third CyberKnife treatment, I was in charge of the cancer. The cancer wasn't in charge of me, and that's how it's been for 2 years. And it's a good feeling. That freedom is priceless.
I'm Laura Wheelis. Eligibility and treatment outcome with the CyberKnife system may vary from patient to patient. Consult with a medical professional.
Cancer is different in different people. Different people survive because they approach it differently. And when I looked into everything I could find, that was the only thing I could find that I was going to bet my life on. And I bet my life on the CyberKnife, and here I am 2 years later.
I was diagnosed with a brain tumor about 1.5 years ago. It is not a cancerous brain tumor, but it's more of a disabling brain tumor that causes hearing loss, facial paralysis, and loss of balance, and can become life-threatening if it would be left untreated. The CyberKnife was the best choice for me because it allowed me to treat my tumor non-invasively. I wouldn't have to go through a recovery from brain surgery, and possibly, all that goes along with that, physical therapy, dealing with hearing loss, not really knowing what the long-term outcome would be as far as, the things that could disable me.
I was diagnosed with cancer of the prostate just a year ago, and my reaction was one of absolute disbelief. I was stunned, and I was really devastated. Once I started treatment with the CyberKnife, I had to be in a room for just about an hour, or perhaps a little less, for 5 days in a row. And after the treatment with the CyberKnife was finished, I rested for no more than a day and then would resume my normal activities. Now it's about 8 or 9 months since my treatment. I have no symptoms. I'm doing my full activities. I'm very active in sports, and I have no complications. I couldn't be happier with the results of my treatment. reasonably long, but not impossible. It was fun to play.
Were there houses?
Yeah, houses all along the fairways.
Unlike the conventional radiation machines, the CyberKnife literally can dance around the room. Those radiation beams can come in from the head of the patient, the feet of the patient, the sides at multiple different angles. That's something our conventional radiation machines, which are fixed, are not capable of doing. And as a result of that, we can get very high doses into the tumor and spare the normal tissue surrounding it.
I think the CyberKnife is a major advance in the treatment of prostate cancer. The accuracy with which we can deliver the radiation to the prostate is phenomenal, and I think it's going to revolutionize the treatment of prostate cancer.
A lung tumor moves constantly with respiration. Conventional radiation, you'd have to radiate the whole area where the tumor might be in any phase of respiration, whereas the CyberKnife, the radiation device actually tracks the tumor and allows us to give a very focused dose of radiation to the tumor, not the surrounding normal lung. The CyberKnife is an excellent option for people that have localized tumors but who aren't candidates for surgery.